Bipolar disorder, a condition often misunderstood, frequently misdiagnosed, and commonly misrepresented in popular culture. Yet, for approximately 45 million people worldwide who live with this condition, bipolar disorder is neither a character flaw nor a creative superpower. It's a serious mental health condition that profoundly affects their daily lives, relationships, and sense of self. Over the next 12 minutes, we'll explore bipolar disorder, what it is, how it manifests, what causes it, and most importantly, how it can be effectively managed. Whether you're personally affected by bipolar disorder, supporting someone who is, or simply wish to understand this condition better, this journey aims to provide clarity and hope. What is bipolar disorder? Bipolar disorder is a chronic mental health condition characterized by dramatic shifts in mood, energy, and activity levels that go well beyond the ordinary ups and downs of daily life. These shifts occur as distinct episodes that can last for days, weeks, or even months. The hallmark of bipolar disorder is the occurrence of at least one manic or hypomanic episode, periods of abnormally elevated mood and energy, usually alternating with episodes of depression. These extreme mood states significantly impact a person's thoughts, behaviors, and ability to function. Unlike temporary mood swings triggered by life events, bipolar mood episodes represent a fundamental dysregulation of the brain's mood-regulating systems. They arise from within, often without any external trigger, though stressful events can sometimes precipitate episodes. Bipolar disorder typically emerges in late adolescence or early adulthood, with the average age of onset being around 25, though symptoms can appear in childhood or later in life. Without proper treatment, bipolar disorder tends to worsen over time, with episodes potentially becoming more frequent and severe. Types of bipolar disorder. Bipolar disorder isn't a singular condition, but exists on a spectrum with several recognized types. Bipolar I disorder is defined by the occurrence of at least one manic episode that lasts at least 7 days, or is severe enough to require hospitalization. Manic episodes in bipolar I can include psychotic features, a break from reality involving hallucinations or delusions. Most people with bipolar I also experience depressive episodes, typically lasting at least 2 weeks, though these aren't required for diagnosis. Bipolar II disorder involves a pattern of depressive episodes and hypomanic episodes. Hypomania is a less severe form of mania that doesn't include psychotic features or require hospitalization. Despite sometimes being mislabeled as a milder form of bipolar disorder, bipolar II can be just as disabling due to potentially longer and more intense depressive episodes. Cyclothymic disorder, or cyclothymia, involves numerous periods of hypomanic and depressive symptoms lasting for at least 2 years, 1 year in children and adolescents. The symptoms don't meet the full criteria for hypomanic or depressive episodes, but still cause significant distress and impairment. There are also other specified and unspecified bipolar disorders that include bipolar-like symptoms that don't fit neatly into the above categories. Each type has its own particular challenges and treatment considerations, highlighting the importance of accurate diagnosis. Understanding mood episodes. To truly comprehend bipolar disorder, we need to understand the distinctive mood episodes that define this condition. Manic episodes are periods of abnormally elevated, expansive, or irritable mood, accompanied by increased energy and activity. During mania, a person might feel euphoric, on top of the world, or unusually irritable, need much less sleep without feeling tired, talk rapidly about racing thoughts and ideas, feel grandiose, with an inflated sense of abilities or importance, be easily distracted and constantly shift between activities, engage in risky behaviors like excessive spending, reckless driving, or uncharacteristic sexual activity. Experience psychosis in severe cases, including hallucinations or delusions. Hypomanic episodes are similar to manic episodes but less intense. The symptoms don't cause severe impairment, lead to hospitalization, or include psychotic features. Many people actually feel particularly good, productive, and creative during hypomania, which can make it hard to recognize as part of an illness. Depressive episodes represent the opposite pole. These periods share many similarities with major depressive disorder and may include persistent feelings of sadness, emptiness, or hopelessness, loss of interest in previously enjoyable activities, changes in appetite and weight, sleep disturbances, either sleeping too much or too little, fatigue and loss of energy, feelings of worthlessness or excessive guilt, difficulty concentrating or making decisions, thoughts of death or suicide. Mixed episodes occur when someone experiences symptoms of both mania and depression simultaneously or in rapid sequence within the same day. This combination, like racing thoughts alongside suicidal ideation, can be particularly dangerous. Between these episodes, many people with bipolar disorder experience periods of stable mood, particularly with effective treatment. Causes and impacts. Bipolar disorder results from a complex interaction of genetic, neurobiological, and environmental factors. Research shows strong genetic influences. If you have a first-degree relative with bipolar disorder, your risk increases tenfold compared to the general population. However, genes aren't destiny. Many people with genetic risk never develop the condition. Brain structure and function also play important roles. Neuroimaging studies have revealed subtle differences in regions that regulate emotion and executive function. Additionally, imbalances in neurotransmitters, the brain's chemical messengers, contribute to mood dysregulation. Environmental factors can trigger or exacerbate bipolar disorder in genetically vulnerable individuals. These include significant stress or traumatic events, major life changes, even positive ones, substance use, disrupted sleep patterns, certain medications. The impact of bipolar disorder extends far beyond mood symptoms. It affects virtually every aspect of a person's life. Physical health often suffers, with increased rates of cardiovascular disease, diabetes, obesity, and migraines. These outcomes stem from both the condition itself and sometimes from side effects of necessary medications. Relationships face unique challenges. During manic or hypomanic episodes, a person might engage in behaviors that hurt loved ones. During depression, they may withdraw or become dependent. The unpredictability of episodes can strain even the most supportive relationships. Work and finances are frequently disrupted. Job performance may fluctuate dramatically between episodes. During mania, excessive spending or ill-conceived business ventures can create lasting financial damage. Self-identity can become confused. Many people struggle to distinguish between their true self and aspects of their personality influenced by mood episodes. They may wonder, is my creativity just hypomania? Is my caution just depression? Who am I when I'm stable? Suicide risk is significantly elevated. Approximately 15 to 20% of people with untreated bipolar disorder die by suicide, one of the highest rates among psychiatric conditions. Diagnosis and treatment. Accurate diagnosis of bipolar disorder often takes years. On average, people see 3 or 4 doctors and spend over 8 years seeking treatment before receiving a correct diagnosis. This delay occurs for several reasons. People are more likely to seek help during depressive episodes than manic or hypomanic episodes, which they may not recognize as problematic. Without knowing about past manic or hypomanic episodes, clinicians may diagnose major depressive disorder instead. Symptoms can overlap with other conditions like ADHD, borderline personality disorder, or schizophrenia. Substance use can mask or mimic symptoms. Proper diagnosis involves a comprehensive evaluation of current symptoms, medical history, family history, and patterns over time. No blood test or brain scan can definitively diagnose bipolar disorder. It requires careful clinical assessment, sometimes involving information from family members who have observed episodes. The good news is that with proper treatment, most people with bipolar disorder can achieve stability and lead fulfilling lives. Effective treatment typically involves medication as the foundation of treatment. Several types are commonly used. Mood stabilizers like lithium, valproate, or lamotrigine help prevent mood episodes. Atypical antipsychotics help manage acute manic episodes, and some provide maintenance treatment. Antidepressants are sometimes carefully used for depressive episodes, though they can potentially trigger mania in some people. Psychotherapy complements medication with several evidence-based approaches. Psychoeducation helps people understand their condition and recognize early warning signs of episodes. Cognitive behavioral therapy addresses negative thought patterns and develops coping strategies. Interpersonal and social rhythm therapy emphasizes the importance of stable daily routines and healthy relationships. Family-focused therapy includes loved ones in treatment to improve family functioning and support. Lifestyle management plays a crucial role. Maintaining regular sleep patterns is particularly important. Avoiding alcohol and recreational drugs, which can trigger episodes and interfere with medications. Regular exercise and stress management techniques. Careful monitoring of warning signs and having a plan for early intervention when episodes begin. Some people with treatment-resistant bipolar disorder may benefit from electroconvulsive therapy, ECT, which, despite its sometimes negative portrayal in media, is safe and can be highly effective when other treatments have failed. Living with bipolar disorder. For most people, bipolar disorder is a lifelong condition requiring ongoing management, but it needn't define one's life or limit one's potential. Many people with bipolar disorder lead successful, fulfilling lives with proper treatment and support. Developing a personalized management strategy often involves building a skilled treatment team that might include a psychiatrist, therapist, and primary care physician working collaboratively. Establishing strong support systems of understanding family, friends, or support groups who can provide assistance during difficult times. Creating a wellness toolbox of strategies that work for the individual, from mood tracking apps to exercise routines to meditation practices. Learning one's unique patterns of warning signs that an episode may be emerging, allowing for early intervention. Planning ahead for crisis situations, potentially including advance directives that specify treatment preferences when decision-making might be impaired. For family members and friends supporting someone with bipolar disorder, education about the condition is essential. Understanding that behaviors during mood episodes stem from a medical condition, not personal choices or character flaws, can help maintain compassion during challenging times. Conclusion. Bipolar disorder represents some of the greatest heights and depths of human emotional experience. It can bring extraordinary suffering, but also offers unique perspectives on the human condition that have informed great art, literature, science, and leadership throughout history. If you're experiencing symptoms of bipolar disorder, know that effective help is available, and seeking that help demonstrates strength, not weakness. The path to stability may not be straight or simple, but with persistence and proper treatment, wellness is achievable. If you're supporting someone with bipolar disorder, your understanding and patience are invaluable gifts. By educating yourself about this condition, you're already making a meaningful difference.